Rachel, we've been talking about chemotherapy, and even today, the majority of the chemotherapy we give is through the vein, given intravenously rather than oral by mouth. Could you talk a little bit about the effect that chemotherapy can have on the veins?
A lot of the chemotherapies can be a little tough on your veins. A lot of them are irritants or stronger, so we keep a good watch on it when we're actually infusing the drug. Also after the fact, sometimes you can have some irritation where you might get like a kind of a pulling sensation in your arm. We want to be real careful to make sure there's no infection starting there, so we always tell patients to let us know if you notice any redness, any swelling, any hot to touch, any signs of an infection, they need to call us. If it's just a minor irritation and it's just kind of bothering them a little bit but no signs of infection, they can just take some Tylenol for it. Even put like a cool compress on it, that might help.
Well, Rachel, I know many patients, we can just give them their intravenous drugs through a simple IV that can be put in and removed at the same setting during their chemotherapy teaching. But occasionally we have patients with more challenging venous access who may not have very good veins or who are getting a chemotherapy drug that's especially an irritant. Can you describe what we might do in that situation?
Yeah, usually in those cases we'll have the patient get a central line put in, normally a port, which is really a minor procedure. It's done, under local anesthetic. You're just at the hospital for a half a day or so. There's really not a lot of side effects with it. Once you get it in, it may be a little tender initially, but after that, you can swim, you can shower, you can do everything you normally do. It's basically under the skin.
So usually what you're saying is we would have interventional radiology or the patient surgeon help direct the placement of that, and it's an outpatient procedure and usually without complication, but because of some of the functional challenges of those catheters, they can clot occasionally or give us problems. We don't routinely put them in for all patients.
Correct.